Hello, everybody. Thank you so much for joining us today. I'm going to go ahead and introduce myself. My name is Kate Edelson. I am the Outreach and Volunteer Coordinator here at NAMI Miami. NAMI stands for the National Alliance on Mental Illness. We provide free support groups, education, and resources for anyone that has a mental health condition or is a family member of someone with a mental health condition, today we will be covering the topic of personalized care for trauma, supporting resilience and recovery. Our presenters will be discussing behavioral health in the face of disasters, especially like the Surfside collapse that happened earlier this year. We have three presenters with us today. We have Dr. James Shultz, who is Associate Professor and Director of the Center for Disaster and Extreme Preparedness at the Department of Public Health Sciences in the University of Miami's Miller School of Medicine. We're also joined by Miriam Singer, President and Chief Executive Officer of Jewish Community Services of South Florida. And we are also joined by Dr. John W. Newcomer, President and Chief Executive Officer of Thriving Mind, South Florida. So without further ado, we're gonna go ahead and get started. I'm gonna turn it over to Dr. James Shultz, who's going to share a presentation with us.
Thank you very, very much for the opportunity to join you this afternoon for this presentation on personalized care for trauma, supporting resilience and recovery. And my role is to lay out a number of more general background points, and then we will go to the folks who are really on the front lines delivering some of this trauma care. As you probably remember vividly, and many of you were from the community, on the morning of June 24th, 1:16 in the morning, Miami-Dade County Fire Rescue received a call for a partial building collapse along the ocean in Surfside at Champlain Towers South. 12 stories of building in two sections, toppled, pancaked, and collapsed to the ground. Almost 100 people were killed and a dozen were injured. So as we move forward on this, one of the things that was on scene from the very beginning, literally minutes after the call, was this impeccable emergency response that certainly has contributed to the resilience of the community from the very first moments. It was an immediate response. It was ultimately an international response with not only our venerated teams from Miami-Dade County, but search and rescue teams from throughout the nation, from Mexico. And in this photo, you can also see the IDF team from Israel working closely together. Very professional response with the discovery of bodies and human remains, a very respectful response, a tireless response through afternoon heat and humidity and lightning strikes, a close brush with Hurricane Elsa, and also the need to demolish the remaining structure. It was truly a heroic response. The rescue phase lasted till July 7th and continued for several weeks beyond that into the recovery phase before the ground was finally flattened and all debris had been removed. This was accompanied by capable leadership, which certainly, and I put this in present tense, contributes to this day to resilience. Front and center was Miami-Dade County Mayor Daniela Levine Cava, but she also shared the microphone with our governor, representatives, senators, and also President Biden made a visit to Surfside. This capable leadership at the county level, and certainly up to the state and federal level, was sensitive, it was constant, it was connected, it was competent, it was cohesive, and it certainly contributed, and to this day, contributes to resilience. I'd like to give you some background in terms of some of the psychological dimensions that we find in disasters. So in a public health emergency, first and foremost, the size of the psychological footprint greatly exceeds the size of the medical footprint. And by that, we mean very simply, more people are impacted psychologically than are impacted medically. In this particular instance, we had impact, death, and harm all constrained to one city block. But the ripples of impact psychologically have expanded dramatically throughout the community, throughout the county, and far beyond, certainly internationally, because of the nature of the victims from all over the world, particularly Latin America, and the strong connection also to Israel. In a public health emergency, psychosocial consequences also extend and expand along a spectrum of severity. What do we mean by this? Anyone in proximity, anyone in the vicinity of the building collapse instantly felt fear and distress. This certainly expanded to far more people at far greater distances. This is expectable, it's understandable, it's common, and usually there's a rebound effect. Almost everyone experiencing fear and distress, and for them, resilience is the default, will regain function, will not need intervention, and will resume their ability to live life fully. But a subset of people, typically those with more intensive exposure, may engage in harmful behaviors. They might increase alcohol consumption, engage in risky behaviors. With some frequency, they may come unnecessarily to local medical centers, fearing that they have been exposed to something harmful. And we certainly have people who are most intensively exposed, including the people, for example, who escaped the remaining portion of the Champlain Tower structure, and persons in nearby blocks and around the community who may go on to develop post-traumatic stress disorder, major depression, or other diagnosable psychiatric disorders. The third point to make is in a public health emergency, psychosocial consequences extend across a prolonged range of duration. Many of you have seen the surveillance camera footage of the twin portions of the building collapsing. It lasts less than 1 minute. Of course, the debris cloud, plus smoke from the fire beneath the rubble, continued to pollute the air and cause exposure to hazardous respiratory substances for about a week or two. But that is now 3 months ago. What is still experienced, which has psychological ramifications, is the loss of resources. Everyone who was in the remainder of the tower saw their tower demolished. They never regained their possessions. Persons in the community and persons far beyond the community are still mourning the loss of almost 100 people who died in the collapse. And there are enduring life changes. The synagogues are missing congregants. The churches are missing parishioners. The neighborhood stores and community get-togethers are missing some friends and neighbors. And so there are enduring life changes, especially revolving around the loss of loved ones, friends, and neighbors in the collapse. There also is an important element in terms of what type of disaster is this? So psychological stress and distress actually relate to the nature and type of disaster. We're well familiar with natural disasters. Certainly hurricanes and tropical storms hit with regularity in South Florida. Wildfires on the outskirts of the county, floods with regularity. And we're in the 20th month of a global pandemic of COVID. And all of these carry a psychological overtone or dimension. None of us are the same as we were before COVID, and we certainly are affected psychologically. But if we shift from these acts of nature, as they've been sometimes called, to human-generated disasters, and the term which actually conveys that now, but is more common, is anthropogenic disasters, human-generated disasters. We really have two types. Most are non-intentional. Harm was not intended. They typically involve a failure of a technology. For example, a bridge or a tunnel collapse, or an air crash or a train derailment, or in this case, a structural building collapse. And we also have got intentional acts that take place. Much of the focus on disaster behavioral health has come post 9/11, an act of mass violence, and specifically an act of terrorism. Now, quite often, the most impactful psychological reactions come from these intentional acts where somebody perpetrates an act intending to harm you. But let's talk today about what happens in between. Anthropogenic disasters that involve failure of technology. Why are these so impactful, and typically more so than a natural disaster? Well, here we had a structural collapse, Champlain Tower South. And the questions that basically plague us are, were human actions involved? When the building was built, was the building built badly? Were inferior materials used? Was there human inaction? Were deficiencies discovered later, maybe recently, that were not acted upon? In fact, was there negligence? Was there advance warning? And in these types of disasters, it is very, very common to seek blame and culpability, to look for who's at fault. In fact, we've actually got that being examined at national, state, local, and community levels. But probably the most troubling of all psychologically is this question. Was this preventable? Could these people still be alive? And that's one of the reasons that this tends to be a really impactful disaster psychologically. And my colleagues on the panel will tell you much more about that. Also, this event was concentric. This was one building on one block in one neighborhood along the beach in the municipality of Surfside in Miami-Dade County. It doesn't get much more pinpoint than this in terms of a super pinpoint concentric disaster. And then all the effects ripple out beyond that. Well, it turns out the psychological impact is concentric too. Not just here. This actually is a diagram that came post 9/11. And we have something called the population exposure model that portrays these expanding rings of emotional impact, starting at the very center of impact, where we have, in this case, 98 to 100 persons who died. And we have several people who were injured. And we have the people around them who are connected to them either socially as family members and they're grieving the loss, or we have the persons who were so close by and barely escaped with their lives. And then we have expanding rings where we have people who are friends and family and neighbors, people whose community has been impacted by this, people who were on the response front lines, people who are going to talk to you today, who have been working ever since the disaster from the morning of June 24th forward to deal with the survivors of this disaster. And of course, government officials, folks in healthcare, chaplains and priests and rabbis who were on the front lines as well. So the mental health and psychosocial support, or what we call MHPSS response, or in the US, we sometimes use the term disaster behavioral health response, is itself a bridge to resilience, to resolution, and to recovery. And that's where I turn it over to Miriam Singer to tell you about what she's been doing since the morning of the collapse.
Thank you, Dr. Shultz. Good afternoon, everyone. A very special thank you and acknowledgement to our colleagues at NAMI, Catherine Coppola and Kate Edelson, for making this possible for us to share information about our experiences in regard to the response to the Surfside tragedy in June. I represent, as President and CEO, Jewish Community Services of South Florida. We are a nonprofit community-based organization that has been in service to our community for over 100 years. Part of our responsibilities involve case management and mental health services, as well as crisis counseling, food support, and senior meals and home care. We provide an array of 40-odd programs that serve every zip code of our community, and our 211 services for crisis intervention, as well as information referral, also extend to all of Monroe County. On June 24th, early in the morning, as I am reading the news, I hear of the collapse of the building, and immediately we deployed a team of professionals to the site at the Surfside Community Center, where Miami-Dade County government officials had established a gathering point for survivors and family members who were looking into the whereabouts of their loved ones who were suspected of either living in the building or were known to live in the building or were visiting the building. And so we, along with professionals from FEMA, the American Red Cross, Miami-Dade County, worked together to provide a triage of services. First, from our perspective, from a mental health crisis response perspective, we assessed the immediate needs of the individuals that were impacted, whether survivors that lived in the building or individuals that were awaiting word of the status of their loved ones. And as you may imagine, there was severe trauma involved and affecting each and every one of those individuals and those families. We spoke to the families, we assessed their needs, We were there, we were present, and we were engaged with the families as well as with the governmental agencies that were present. In addition to the governmental agencies from our own community and the federal and state Department of Emergency Management, we also had representatives from the Israeli consulate present that were arranging for individuals that had family members that were impacted to fly in from Israel and other parts of the world. There were volunteers from Hatzalah, South Florida, an emergency ambulance response team with medics and physicians and nurses that were there to attend to the immediate medical needs of individuals that were awaiting word in terms of the outcome of the immediate search. And this continued. This continued for a period of 3 weeks through 3 venues. Subsequent to the Surfside venue being closed, there was movement to 2 different hotels where many of the family members were lodging, as well as where there were briefings twice a day by officials from Miami-Dade County. In each of those venues, licensed professional trauma-informed clinicians from Jewish Community Services were present to provide supportive services and one-on-one care through the briefings, through one-on-one meetings with family members, and through providing additional supportive services, whether temporary housing, whether financial assistance, as many folks who are survivors lost all of their belongings. It was only with the clothes that they were wearing that they escaped the building or were rescued by the Miami-Dade County fire officials. So we tried to work with the focus on psychosocial care, understanding that the intervention that would be most effective in order to prevent long-term PTSD involved immediate work and processing with a therapist, and also understanding that there were many of the survivors and the family members that were awaiting word that were in shock and trauma and not yet ready to engage. So part of our involvement was monitoring and assessing. Part of our involvement was providing psychotrauma intervention where needed and where individuals were ready to receive. And we also provided another measure of a bridge to services and resources for those individuals that were displaced, and for those individuals that also were family members that have flown in from other parts of the world in order to see about the status of their loved ones. In our work with the clients, with our Surfside clients, we also were asked by the Miami-Dade Police Department to participate in the briefings with the family members once a family member had been identified by the urban search and rescue team. And these were perhaps the most difficult and challenging from an emotional perspective of meetings. There was always someone there, either a victim's advocate and a clinician, or a clinician and another representative from the Miami-Dade Police Department to provide supportive services from a psychiatric, psychological perspective to our clients. In addition, for those clients that required immediate care, we had on-site clinicians that were ready to provide private sessions to the clients and their family members. Our offices were also available for sessions off-site once the clients asked to have some private time away from the 3 sites and the 3 venues within Surfside, and ultimately Bell Harbor at the Seaview Hotel, which was the last location where the families received the briefings prior to the closure of the search and rescue operation. One of the other aspects of our work involved a collaboration across agencies. We immediately briefed all of our funding partners in regard to the work that was being done. We received significant support from every funding partner, whether it was Thriving Mind and the Department of Children and Families, the Department of Emergency Management in the state, FEMA, Miami-Dade County, the United Way, the Greater Miami Jewish Federation held hands with us. We were partners with the Rabbinical Association, the Archdiocese, And we used the established network to augment the services on site as we identified the needs of each of the individual and family members. In addition to that, we welcomed 3 teams from Israel, a psychotrauma team from the IDF, Israel Defense Forces, as well as the integration into Miami-Dade County's urban search and rescue efforts of 3 Israeli IDF teams and 1 Mexican team from Mexico, as Dr. Shultz mentioned. This collaboration was something that was not planned. Basically, there is no set plan or continuity of operations plan for instance like this. What we saw was an amazing sense of purpose and alignment and coordinated effort, even though there was not a specific plan in terms of how to address such a catastrophe. And it was an incredible sign of the readiness of the professional first responders, the governmental agencies, as well as the funders that provide human services in terms of their ability to pivot, to be flexible, and to be in tune and really to target the individual needs of the clients that required services in the most compassionate and caring way. We saw the best come out from our professional colleagues throughout the community that are in the business of caring for others, whether governmental or nonprofit. And we also saw an incredible alignment in terms of the focus being on the care for the individuals and families that were impacted. There were no turf wars that I discerned. There was no competition, quite the opposite. There was space for all that wanted to help. In fact, in many cases, we heard from some of the clients that there were too many offering to help. And that was one of the challenges in regard to trying to organize ourselves for all of the goodness and sort of well-intentioned individuals and caregivers who wanted to come on the site to support. And there was, I want to say there were over 4 dozen licensed professional psychiatrists, psychologists from the local universities and private practice that volunteered their time. In addition to that, we were able to embed a professional group of trauma clinicians from Houston's Jewish Family Services who had experience with displacement and trauma, having faced 9 floods in 5 years, 9 catastrophic floods in 5 years. They immediately offered to come, came, and were integrated. And an important component of the work that we did was to be mindful of self-care. Self-care for the frontline professionals that had been listening to the stories of trauma and loss for weeks on end, on site, working with families, trying to process information, providing supportive services and case management. So in any such effort, it is important to include a component of self-care for the caregivers, and that continues. Subsequent to our efforts over the first 3 weeks through July 23rd, 4 weeks, we were asked by the United Way, the Red Cross, and a number of other partners in the state of Florida to consider the long-term case management for these clients. And we accepted that opportunity. And frankly, it is a privilege. We are now serving 169 clients that are directly related to loss and or survival of the Surfside tragic collapse of the Champlain Towers building. And many of our clients have received support to find temporary housing. Initially, many survivors were in a hotel setting provided by the American Red Cross, receiving services from FEMA. The Red Cross and FEMA are still our valued partners, and they have closed their local support services programs and are supporting us in the case management services provided. We anticipate a 5 to 7 year horizon of care and healing as we learn from other agencies that have experienced this type of catastrophic occurrence in a community. And we continue to communicate on a one-on-one basis with our clients, and we have a weekly call with them where we bring guests to address unique issues, whether it's a FEMA representative or a congressperson or the mayor. We are in partnership with Miami-Dade Police Department because of property issues. We're in partnership with the court receiver, Mr. Michael Goldberg of Ackerman, who is the court-appointed representative as the receiver in terms of bringing information to the clients whenever they ask. And we do facilitate resources as they are needed. We have also been blessed with significant fundraising by the Greater Miami Jewish Federation and the Shoal of Bal Harbor to address most any financial need to stabilize and for care of the clients. So all in all, the community has come together in a very significant and positive way to respond, but the road is long. The road for healing is long, and the road for the opportunity to serve and care for our clients and provide support to them will continue. So in sum, I really appreciate this opportunity and would like to introduce Dr. John Newcomer, who is the president and CEO of Thriving Mind, the managing entity that provides funding from the state of Florida and is our oversight partner for mental health services. So John, welcome.
Thank you, Miriam, and thank you, Dr. Shultz, and thank you again to NAMI for organizing this. Great conversation. By way of background for the group, Thriving Mind South Florida is one of 7 so-called managing entities in the state of Florida. We're the safety net provider is one of our key roles for people who are uninsured or underinsured, living below 200% of the federal poverty level. We get funding from the state to create a safety net. 40 some odd healthcare provider organizations. We fund small and large nonprofits. We are a nonprofit with very low overhead. That's one of our roles. The other role, relevant to this conversation today is we're by statute and, ongoing legislation, we're often called upon to be an organizer or a convener. House Bill 945 here in Florida is trying to make sure that children in schools who have mental health crises get access to mental health services before law enforcement might get involved. We do things like that. We end up supporting maybe 125, 130,000 people a year with one level of service or another, including prevention. The other point I'd want to make is that part of our funding from the state of Florida is for crisis counseling. As many of the people I've seen in the chat, that we have people in the audience who are not necessarily from Florida. Everyone from Florida knows this, but I'll just say it for those who are not. Florida routinely is hit by hurricanes. And so in Jim's talk, he gave a very nice overview of the different types of traumas that may happen, one of which we experience routinely, through these natural disasters, hurricanes and floods and things like that. And the funding that we have to support crisis counseling is used every year, for one or another of these crises. So when this particular crisis happened, and one of our trusted providers, Jewish Community Services, run by Miriam Singer, was actually literally there around the corner. I mean, it was a beautiful opportunity. They were on site, and we ended up paying for all of their billable hours from inception, the beginning, the first day, night, of the crisis, through the decampment, of the site. As Miriam said, they've gone on to do some long-term needed follow-up for folks. I'll make another comment that again speaks to some really great collaboration. Miriam spoke to this already, but great collaboration in the community. As Miriam mentioned, the Red Cross got involved early on. to not only bring services to the table acutely and work with Miriam and others on long-term follow-up planning, but the Red Cross has been a great partner with Miami-Dade County, and we're of course involved in this as well, to plan for the next disaster and see if we can't get out ahead of some of these issues, particularly a little bit of the traffic jam. As Miriam said, it's a traffic jam in a good way, with lots of people coming to help and making sure that, you know, we coordinate the services as best as possible. I wanted to use the second, part of my comments and then leave plenty of time for questions. I wanted to use the second part of my comments to leverage, another hat that I wear. I've been funded by the National Institutes of Health or other federal agencies like SAMHSA to do research in psychiatry. I'm a psychiatrist by training, a physician scientist, for 30 years. And there's been a tremendous amount of work done over the last 30 years on understanding trauma and understanding PTSD. Dr. Shultz referred to some of this, but I wanted to make sure that the group, understood some of the top line lessons. Again, Dr. Shultz made some of these points. I want to underscore some and amplify it. That 30 years ago, most of what we understood about what we had begun to call PTSD was learned from the experiences of military veterans, people who had been in combat. And there was we look back now, shockingly little information about the experience of, everyday citizens who, in Dr. Schultz's nice slides, could experience a range of different, even non-intentional, human-based traumas. There was so little information about this. People weren't quite sure whether PTSD or its risk factors or its outcomes looked the same. So there was a huge effort by one of the 20 some odd NIH institutes, the National Institute for Mental Health. NIMH funded a series of contracts to try to understand more about, if you will, civilian experience, of trauma, that could come from different sources. I spent 20 years at Washington University in St. Louis, and a wonderful team led by Liz Smith and Carol North and others got a series of contracts at WashU to go out in response to a series of tragic events: the first World Trade Center bombing, the Oklahoma City bombing. Remember, that was a homegrown terrorist event. The Nairobi embassy bombing. There are a series of these events where civilians were impacted, by these horrible, devastating, traumatic events. And a team of researchers was deployed to essentially encamp for 3 or 4 months and interview. It really, I liked it, Dr. Schultz's slide, to interview those 2,000 people, who are touched in the whole set of concentric circles. And amazing and consistent lessons were learned that I want to summarize for you. So in the criteria for PTSD, one of the critical criteria is recurrent thoughts, recurrent nightmares, recurrent, emotional experiences. Basically, the take-home message was virtually everyone who's in one of those disasters is going to have recurrent thoughts and nightmares. It's almost like a normal human brain response. So, so let's put that off to the side, and we're going to come back to the question of, right, where's resilience and where's disease and how do we help people? So virtually everybody's getting recurrent thoughts and nightmares. If you were in a building that exploded and there was a loud noise, Surfside survivors describe these, terrifying, loud, noises. If you're in one of those situations and you hear any similar loud noise, in your subsequent years, you're going to have a reactivation of some of those memories. And they're not dry toast memories. They're highly charged emotional memories. Your brain is designed to activate, a huge emotional response, in response to those noises or stimuli. Virtually 100% of the 2,000 people, right, in this circle, if they heard one of those noises, they got what we talk about as autonomic activation. Your heart rate goes up, you start palms sweat, you feel nauseated, you get that physical response to re-exposure to the same kinds of stimuli. The third big category of symptoms for PTSD is what I'll call withdrawal, that you pull back, that you aren't able to engage, whether it's with work or family, emotionally, you've withdrawn. And that was the really important distinguishing characteristic. Not everybody got that. And it's to Jim's point in the first talk today, many people go through these just horrific traumas and yet demonstrate tremendous resilience and go on to somehow incorporate this. It's not that they don't have recurrent thoughts and nightmares. It's not that they don't have autonomic activation. It's that somehow they keep going. They keep talking to their family. They keep staying engaged at work and in life. And what, Jim, I'll look to you and maybe we'll get some good discussion going. I mean, what I don't think the field has gotten a whole lot better at over the last 30 years is predicting who's going to, at the front end, who's going to go on to have a resilient response and who's going to be exposed to the very same trauma and now really be brought to their knees and have trouble functioning. And I'll sort of wrap up my comments by saying that this relates so much to what our community did, what Miriam and Jewish Community Services did. We want to deploy services to everyone who needs it. And one approach, when you can afford it, in our situation, a very engaged community, we happen to have the resources there, right? It wasn't in a rural location. It was in a place that, we had Miami-Dade Fire Rescue and law enforcement and our local and state resources. In that situation, you can try to touch everyone. But in other situations, you don't have the resources to touch everyone. So how do you decide who really is going to be at greatest risk and who needs the most help? And then I guess I'll end with, there's a provocative question that's sort of out there in the field. And that is, if you're destined to be resilient, if somebody has been through a terrible trauma, but the way their brain is wired and their experience, they're actually going to be resilient. There's actually an argument that for some of those folks, they're going to try to form a scab, if you will, and seal over and, incorporate the memories in some way, but not, spend too much time rehashing and each day working themselves up. And because remember, the way memory works, it's not a static thing. Each time you re-remember something, you rewrite it. And if you rewrite each memory each day with a lot of emotional overlay, the memory becomes increasingly attached to those anxious or depressed feelings. So the big question in the literature right now is, gosh, we want to help everybody, but are there some people where we need to calibrate the help that we give? and make sure that we support them, but not, drag everybody into, in-depth therapy, about it. And that's, I think, Jim, you're kind of a scientist working in this area, and I'll look to your comments. But I mean, that's where I think the cutting edge still is, figuring out how do we best deliver, not only, from a financial and an organizational standpoint that we've been talking about so far, but how do we best tailor our treatment response to exactly what each individual needs, so as to promote resilience, back to our title, promote resilience and treat, folks who are in need of recovery.
So there are a few questions, and I hope that others will feel comfortable asking other questions that are pressing on your heart and on your mind. So I have one question that came in from a friend of mine, not here on the chat. She's been traumatized by Surfside, and she has not sought mental health treatment. She lives in the area. She doesn't want to say where or what building. Is it too late for her to do something, either with you, Miriam, with JCS? What would you suggest she do?
So I would suggest that she call 211 and identify herself as being related to the Surfside response. And we will gladly have someone from our access team provide an intake and refer. We refer to mental health agencies throughout the community as well as within. To JCS, we have 3 mental health practices, and depending on the location of where the individual lives or works, what is convenient, we refer for services, counseling services. It is definitely not too late. Everyone works with their own timing in terms of their readiness to seek help, and that's an important aspect of healing. So I would encourage your friend to please call 211 and identify as someone that has experienced a loss or it requires services related to Surfside, so that we may provide necessary support and services.
Yeah, and if I could just add to that, Miriam, that 211 is an amazing helpline service that is supported by Miami-Dade County through the Children's Trust, and also by Thriving Mind. But they can connect you, as Miriam said, to an array of community services, including Thriving Mind's network of service providers for people who are uninsured. So there's plenty of opportunities to connect to providers if you do have insurance or an ability to pay. But even for those who, as I mentioned at the start, are below 200% of the federal poverty level and uninsured, we can help those folks as well.
And I'd like to add that Thriving Mind is one of NAMI's funders, and so we thank them for our helpline, our warm line as well. And so we also give out resources to some of the those that Dr. Newcomer has funded. And if someone calls us now for Surfside, specifically for Surfside, we'll make sure that they get in touch with the JCS.
That would be great. And Kathy, let me just add, many thanks to the state of Florida, the Department of Children and Families, who budgets us for that safety net. We go out and get additional funding from NIH, from SAMHSA, from the Attorney General's office, a variety of different sources. We're building a trauma recovery network for victims of crime, victims of violent crime in particular. So lots of resources. Reach out to us, and 211 is, again, a great, starting place.
There's a question, Catherine, from Erica Liverman.
Okay.
Regarding, so Erica's question is, are there any ways the community can help in the aftercare portion? So yes, recently we partnered with the Florida Art Therapy Association And we had an event on Sunday, an art therapy session for survivor clients at the Bass Museum. There are all sorts of creative ways to provide support, So if you are interested in a volunteer role, please don't hesitate to call. I believe our contact information will be displayed at the end of the webinar, and you can always reach me by email.
And I will also be putting information out to everyone who's registered, and as at the end of the webinar, so you'll be sure to have both Dr. Newcomer, Dr. Shultz, Miriam Singer, and some other information. And if you have any questions, I know them, they'll be happy to answer some questions.
So the only other thing that I thought of, and I'm sorry, I had a frog in my throat, Kathy, is that we actually opened a home goods store for the benefit of Surfside survivors that are restocking their homes. There were so many generous people, including the state of Florida collected 37 pallets of household goods. So we actually opened a store in a warehouse, and by appointment, anyone who is a Surfside survivor and requires to restock the household supplies, whether it's pots and pans or mattresses or pillows, we're able to provide an appointment. So if individuals wanted to contribute goods, unused goods, or go on Amazon and put together a cart and donate, JCS also has a home goods store that is available for Surfside clients to come in, and free of charge, of course, and have a shopping experience so they can restock.
Lovely. That is wonderful. I hadn't heard that, Miriam. So that in itself is a big piece of information for the community to share with each other and to have on our resource list. One of the questions from Celia Morales is, what can parents do to help their children foster resilience? And I'm going to say for disasters, for whether it's Surfside, whether it's a hurricane, but particularly to the disasters.
Miriam, you want to go first?
I can, sure. I'd be happy to. So the first recommendation is to have a conversation with your kids. Here in South Florida and Florida, where we have a hurricane season, and many of the schools, public and private, have conversations at the classroom level in terms of hurricane preparedness and climate change and what a storm means. I think at the family level, it's important to have those conversations in terms of how you prepare in the event that there's a storm. And that conversation in and of itself helps build resilience, so that a child will learn that there are alternatives. How do we plan? We stock up with extra water bottles. We have candles and flashlights. Some families have a generator. We have a backup plan in terms of a safe space. This is the house to go to. So similar to the planning process for a hurricane, the conversations within the home as a family and the family preparation plan is something that is recommended in order to have a sense of readiness and a resilience. And nothing can ever prepare anyone for the horrific tragedy, what happened to our Surfside families. And that there is a different type of process that happens to address the trauma and the phases of grieving and loss. But in terms of building resilience now for any family, I would say the natural event that we experience is a hurricane. And we've been very fortunate, thankful, blessed that we haven't had a major storm. But for those of us that lived through an Andrew, we have lived through that, but many generations that followed have not had such an experience, thankfully. Those conversations are important, they're rich, and building upon those helps to convey the understanding of what resilience is for young children.
Yeah, and I think those are great comments. I would just add, and I'm not sure exactly what Celia's exact question was, but in terms of children, not specific to any one trauma, children and ways to foster resilience. I would actually point you to, if you guys look up on Twitter or Facebook or LinkedIn or anything, Thriving Mind has a relationship with Sesame Street in Communities. And Sesame Street in Communities has been working, funded by the Robert Wood Johnson Foundation, for some time to essentially build resilience in communities with children by starting those dialogues, those conversations that Miriam just talked about, giving parents tools and caregivers tools to open those conversations. You know, I'm in my 60s, my kids are in their late 20s, 30s. It's not our Sesame Street anymore. It's gotten much more sophisticated. There are characters where a parent, you know, is experiencing homelessness. There are characters where a parent is experiencing a mental health or substance use problem. And they give really interesting ways to open those dialogues. I mean, it's not the be all and end all, but it's a really nice example, and probably why they've gotten repeated funding by the Robert Wood Johnson Foundation. A really nice example of just the kind of community-based resilience building that Celia is asking about.
And John, I think you may have typed an answer to Joy.
I'm trying. Yeah, I didn't quite finish yet.
Okay, well, I don't know if you want to answer it. So is it so the question is, and it comes up not in the chat. She knows 2 people have lost family members in Surfside. One has shown extreme resiliency, and the other basically can't not function. Is it just the way people's brains are wired that such extreme differences find themselves?
Yeah, so I just finished the sentence and sent it, but to answer verbally, yes, yeah. Great sort of question. Right, in the world that Jim and I, you know, live in the kind of university space, people talk about gene-environment interactions. You know, that people have their genetically determined risk, and then they experience environmental effects. And environment, remember, starts in utero. You know, kids who get exposed to 3rd trimester influenza, you know, in mom, have been shown to have changes in sort of brain vulnerability, you know, to subsequent environmental exposures. Kids who get late 3rd trimester exposure in mom to alcohol or an anesthetic agent, you know, for a surgery. These things are known to have some impacts on the way the brain gets wired. So that's a kind of, you know, gene-environment interaction. But where I think we've all seen this is you have 2 kids, or for that matter, you know, you have 2 of the wonderful, you know, like some of our family, you know, pets, right? Two dogs in the very same litter get exposed to, right, presumably the same sort of genetic background, but they end up being temperamentally very different. And, you know, some people, some mammals, some humans are more vulnerable to these stresses than others. And even if you start out with the same genetic vulnerability, and Jim, I think, you know, mentioned this, if someone is repeatedly exposed to trauma, you know, repeated events, that is a different thing than someone who has their first exposure to trauma when the building collapses, you know, at age 25. And it's very clear that those repeated early exposures or pre-existing depression, anxiety, or other problems really, you know, puts you at higher risk for having a tough time responding to this next trauma. I think, Jim, I kept waiting for you to chime in.
So yeah, so thank you so much. Now we've got 2 clinicians here, and I am the person who's not the clinician, so I've been pretty appropriately deferential to having clinicians ask clinical questions. But there are a couple of things. There's also a note in the chat as well from Melissa about a family member who's a Parkland shooting survivor. So you were asking earlier, Dr. Newcomer, about, are there things that predict who will do better or worse? The Q&A that came up before is it could be that, both of these folks known to this person who wrote the question, lost a brother in the collapse. It could be that one person lost a close family member and someone lost a more distant friend. They both knew people in the tower, but perhaps the level of relationship makes a difference. Sometimes even the physical proximity. So you actually worked at WashU with Carol North, and she went on, I think she's at UT Southwestern right now in Dallas. She went on to do a whole series of studies, particularly on school shootings, which somewhat relates to the question from Melissa in the chat. And one of the sets of studies that was done, it may have been by her, I think it actually was, but there were at least some studies where they found kids on the playground when children were shot on the playground. They literally got out measuring tapes and found out for the kids in the school at that moment, what kids actually had psychological impacts. And they could literally find that the kids who were either on the playground at the same time or close to the playground or in classrooms that overlooked the playground had higher rates of PTSD, for example, than the kids who might have been in a far corner of the school. That might also relate to, of the thousands of kids at Parkland that day, who are the kids more likely to become impacted. And for example, when we go back to Surfside, you've got that tall building, which I do not recall the name, the one that was right next to the footprint of Champlain Towers, where for at least a month, the folks in that tower, including maybe some of their kids, could spend many hours a day if they chose, or if they just were gravitating to that, looking down on the rescue site, okay? So their exposure wasn't just the moment of collapse. For some of the people in that tower who might have just been absorbed in watching the rescue, they might have actually had a month of exposure. So it's duration of exposure, proximity to exposure, intensity of exposure, and closeness to the people who are affected, which kind of play out in different ways.
To add to Dr. Shultz's comments, the clients that we are seeing are also individuals who worked in the building, individuals who lived across the street and saw it happening. We are also always concerned about the urban search and rescue teams and the caregivers in terms of providing them support through processing their experiences and identifying and finding remains of loved ones that did not survive. Even the individual caregivers, as mentioned, self-care is a very important part of a healing community. And so the importance of continuing to care for the caregivers that have been faced for processing and counseling and providing therapy to clients. We continue to offer the support even to our own staff and to others in the community. Recently, we provided services to employees of Surfside. For example, the police departments and the employees of Surfside, Bay Harbor, Bell Harbor, are a focus of interest and concern and ongoing support and care because of what they experienced. Their whole world changed in every which way. In terms of the aspect of self-care and emotional well-being, it's important for the community to know where to go to seek help. And several of the comments on the chat, there's one participant that asked, what if, if I'm not a Surfside resident, not impacted by Surfside, what other resources are available? So Dr. Newcomer spoke of the resources provided through the state of Florida, through our managing entity at Thriving Mind. There are resources available for crisis counseling, for therapy. We have in this community a healthy cadre of licensed professionals, individuals that are experts in trauma-informed care. There is cultural sensitivity and cultural competence in the array of languages that our community speaks. So that's an important aspect of healing as well, to be able to have cultural awareness and sensitivity in the way we care for others. So just wanted to add to your comments.
You know, one more point on that, and it goes back to sort of the second question that Dr. Newcomer was asking. He was asking first, are there predictors? And it tends to be more the proximity, intensity, duration of exposure, which has some predictive value in terms of who is more likely to not do so well. But then he was also asking, I think I took a note here, is there a way to calibrate help? In other words, do we actually try to give help to everybody in, you know, the building, everybody in the nearby several blocks, everybody who was in the school during a shooting? And the answer is basically no. And a lot of that came out in part a powerful NIMH meeting that was right after 9/11. It wasn't scheduled to be after 9/11, but it continued to go on after 9/11, November of the year, so 2 months post 9/11. And they were actually at that point, a fair amount of the discussion was around something which does happen. And Miriam Singer was talking about the importance of working with first responders. First responders in some parts of the country, in some parts of the state, because we did lots of disaster behavioral health training post 9/11 all over the state. And there are certain responder groups that to this day use basically critical incident stress debriefing approaches, where one issue about that is that most of the responders get the same sort of approach. And part of that approach, it's not just that one, but sometimes people are asked to talk about, you know, what did you experience? And sometimes even talk about what was the worst experience. And that can actually be, for some, re-traumatizing. Or you're hearing things where you already had a bad day, but then when you're in a group setting with perhaps your team of responders, then you're hearing about something even worse. And so the issue is there are some people who actually will bounce back, be resilient without intervention. So you do need to think about watchful waiting as opposed to leaping in to help. And also you have to be cautious of doing basically the same almost recipe approach to every single person, because there is a possibility of psychopathologizing, basically making something look like mental health issues when they're not, or possibly re-traumatizing if you sort of force people into group settings where they have to hear bad experiences of teammates. So those are some things to consider. There's not a perfect solution, but yes, not everybody needs certain types of interventions.
Thank you, Dr. Shultz. So I want to be mindful of everyone's time. This has been a really thought-provoking conversation. It's awesome. It's better than I even expected. And I know you all, and my expectations were high as it was. So thank you. So thank you to Dr. John Newcomer, Dr. James Shultz, Miriam Singer for taking the time out of your extremely busy schedules, and I know how busy they are, to share your expertise with us. I'm also going to mention to our listeners and those who listen to this recording later about the rather new South Florida Mental Health Collaborative, which is spearheaded by Red Cross of South Florida, Mayor Daniela Levine Cava's office, which started after the Surfside building collapse. And we are all a part of this new collaborative, which is bringing together organizations as a work group to assist in the preparedness, resilience, and recovery from mental health issues due to disasters. If your organization would like to join the collaborative, we'd be happy to have you. I'm going to send you all the information for our panelists today and for the Red Cross and Deborah Koch and Susan Holtzman's from the mayor's office. I'm going to send it out with the recording. And just please remember that NAMI Miami-Dade also offers free programs, a helpline, a warm line resources, not specifically for Surfside as JCF is working with, but for others and for those who don't have insurance or do have insurance. Our free programs are currently on Zoom, including 9 weekly support groups. We also have education programs. So if you'd like if your organization would like to have one of our free presentations, just call us, email us. and would be happy to schedule one for you. And I hope to see you all at the next webinar, at our next program, and have a peaceful day. And I will thank you all for being here with us today.
Thank you, everybody.
Thank you so
Thank you.
much.
Thank you. Be well, everyone. Stay safe.